Welcome to another episode of the Earn It podcast. On this episode, how do you get the most out of clinicals in nursing school? All right. So, big one on this episode. I'm going to go over a few different things. We're going to go over what you should do to really be prepared, and I'm not talking about materials. Managing your excitement, your professionalism. A really big one that a lot of folks listening might be interested in is dealing with nurses that do not want a student that day, and I mean really don't want a student. Learning from the real clinical environment, how to actually learn from it, and how to make the most and how to properly manage some of those really difficult assignments that you are inevitably given whenever you have to go to clinicals. A lot of really long assignments. Some schools call them case studies. Some schools call them journals. So there are a lot of different names for them, but you all know what I'm talking about. So let's start off real quick. Understanding what clinicals actually are. The one big thing up front is that you really need to change your goals, or you need to realize what kind of goals you have in your mind. If your goal is, I'm going to show up this day to do cool stuff and to do the cool hands-on skills, and that's what I'm here for, you need to realize that you are not entitled to do any of those things. In fact, you're not entitled to any specific experience during your clinicals. You have to realize even if you're not really big into I'm not trying to be old school hierarchy here in medicine, but you are there to learn as a student, but you're not going to a school, you're going to a hospital. So the biggest thing is to understand, have that mantra in your brain if you need to manage your expectations. This is a hospital, not a school. It is not about you. You're along for a ride, and that ride is taking care of patients, not teaching you. You showing up does not change the priorities for that nurse that you're going to be with that day. And I'm going to talk about that more in point 3, obviously, but you just need to go into it and don't have any expectations for, I hope I get to do A, B, C, D, E, F, G, because those opportunities might not come up. And even if they do, you're not, entitled to get those experiences. If the opportunity presents, obviously seek out that opportunity. But if you are told, no, I think we're going to hold off, or no, no, thank you, or I'll do it myself, you need to manage your feelings, because that's not a time for you to get offended. Or if you are going to get offended, don't mention it at the end of the day when you get back together with your professor. Don't mention it during lunch. It's not anybody else's problem except for yourself, right? There are a few exceptions to this that I will talk about again when we're talking about managing nurses that really don't want to have a student. You need to understand that the medical knowledge that you get in class and what you're tested on, that's not what it's about. That's basically what you need to have as a baseline understanding for building up what actions you're going to perform throughout the day. But that's not what it's about. If you're a straight A student because you ace all the tests, you ace pharmacology, realize a few things. Realize first and foremost that it helps you, but it doesn't matter too much, because you can look anything up anytime, and everyone does. And there are a lot of things that you now know that your nurse has long forgotten, because they are not important in order to carry out everyday nursing care. That's a big one that you got to realize, okay? Clinicals are about managing people and managing time in an environment where the medical knowledge is just a given, okay? Pay extra attention to what the nurse does or does not get concerned about. Learn what to freak out about, what not to freak out about. Learn what they notify the provider about and what not to notify them about. This is another tricky situation where you have two different things. You have what the books tell you, you have what the exams tell you notify a provider for, and then you have reality. A big one is, you look at the labs. You'll see this in a lot of tests, depending on where you are in nursing school or if you're already a nurse. I'm sure you remember the emphasis on notifying the provider about an elevated white blood cell count. And I guess if it's like critical or something, you will. I'm not talking about critical lab values. That's an entirely different thing. But, I've been with a nurse and it's like, hey, this person, after 3 days in the hospital, randomly, they have had normal white count, and randomly their white count is double what it was the day before. Do we just tell the provider about that? And the answer was no, because the provider is watching that, right? So there are certain things you have to realize. You're working in an interdisciplinary environment, and those other people have responsibilities too, believe it or not. So in reality, in a lot of settings, you need to basically go, when you're there, you go by what your nurse is doing and your nurse's reasoning for a lot of things. Unless somebody is in legitimate, immediate danger, keep your mouth shut and be like, oh, that's interesting. Thank you for that. So another thing is you need to be really thankful. You need to be really grateful that this person, if they go to teach you anything or they take the time to, tell you, oh, this is why I'm not going to notify them about this. If X, then I would. But this, if they're taking that time, oh, thank you so much for that. I appreciate that. I'll write that down. And that's something you can later talk about. Hey, I've noticed in our exams, this is kind of like a really big deal, but it's not really a big deal in the clinical setting. Was this my nurse, or what is that just a reality of working and knowing that the doctor has a responsibility to interpret the labs that they ordered, right? And again, you should ask the questions if you're not 100% sure. Could you get paired with a nurse that is just over it, or they're having a bad day and they could have falsely told you that on purpose or accidentally? Of course. So that you clarify later. What you don't do is continually push back. Okay. Managing your excitement and maintaining your professionalism. Okay. This comes down to two different things. I talk about kind of, if you don't get to do something, you need to manage your feelings. If you get offended, it's not their problem. It's nobody else's problem but your own. And you need to manage your emotions and, take a second and formulate any questions you have for later. But you don't let that rule your experience, what you get to do and what you don't get to do. Again, it's not about you while you're there. The same goes for when you do get to do things. You might be really excited to do something, but there are two things to this. One goes into how everyone on the floor, and including your nurse, perceives you, and how that feeds into, a lot more nurses maybe not wanting students, is because this excitement factor can be really annoying. Let's talk about the nurse part first. Some of the things that you're excited to do, your nurse is not excited about anymore, and pretty soon you won't be excited about it either. This could lead to a nurse viewing you as either naive or immature when really you're just really excited for the learning opportunity. So sometimes you have to tone down that excitement. And there are times for the patient's sake that I'll talk about next that you should absolutely turn that excitement down to absolutely zero. But why would you tone this down for your nurse? Why does it matter? If they're not excited, but you are, like, what's wrong with me being excited? Well, they could view you as that because what you don't yet realize is those things that you're now excited to do, you don't care if it takes 10, 15, 20, 30 minutes, do you? Because you're there all day. You don't have any other responsibilities other than learning at the end of the day. Your nurse has many other patients, many other medications to manage. They're getting discharges, they're getting admissions, and there are a lot of things going on. So anything that's going to take that nurse's attention for up to like 20 or 30 minutes means there are a lot of things on that to-do list that aren't going to get touched for 20 to 30 minutes. They're going to be unreachable during that 20 to 30 minutes. And it even, if you want to think deeper into it, because of that, if someone's IV is beeping 5 minutes into a 30-minute long procedure and no other nurse is able to go in there and stop their IV from beeping, that person's IV is going to beep for 25 minutes And then you're eventually going to get there. And then that person's going to be angry at you and maybe complain against, about you to the charge nurse. And then you're going to have a meeting with your boss. There's so much to it. So you have to realize that's why they're not excited. At one point they were too. It's because you're getting to do things that some of you and some of us have like, oh my God, I'd love to be able to have that in my scope of practice. That would be so cool. And you're finally at the point where you're able to do these things. And it is really cool. But one day it's not going to be cool anymore. One day it's going to be, oh my God, I have so much to do. I can't believe I have to do this too. This is going to take me 30 minutes. Now, then you have, I have a student with me. I can have that student do that with their instructor while I do my other task. Okay. And that's why, and that's perfectly acceptable. I mean, you have a student there, they would love to do it. You should let the person that loves to do it. But another thing you need to realize is, you being able to do those things, I guess another reason why you shouldn't really be that disappointed in not being able to do certain kind of hands-on skills is because no matter how many opportunities you get during your clinical rotations, there is no skill that you are going to quote unquote master while you are there anyways. There are skills you can get kind of good at, but as far as mastering and basically you're starting your first day of being an RN and you do it as good as everybody else there, I'm sorry, your Foley placements, your straight caths, your IVs especially, you're not going to be good at it. Certain one of those skills, like maybe IVs, you will be if you were previously an EMT or a paramedic or something going into it. But that's about it, right? So when else should you tone down the excitement? A big area where you should tone it down is in front of your patient. Those of us with clinical experience of any kind know that it's very important that you have a poker face and you should be the only calm one in the room if something is going seriously wrong, because if you are in charge of a patient and something very bad is happening and the family's in there or the patient is still somehow with it enough to be freaked out by you being freaked out yourself, you could cause a lot more anxiety unnecessarily. We all know this. Some of us have not yet been able to practice that, and some of us have. So, the same goes for excitement is my point. Your skill that you're doing for that patient might be really exciting for you, but it could be a horrible experience, embarrassing experience, painful experience, a scary experience for the patient that is undergoing that skill. Okay. I often verbalize to my patient, I'm going to do this IV. I have done this before. I'm not going to poke you, with a needle, unless I'm absolutely, unless I'm very confident in it. I'm confident in my abilities to start an IV on you. Sometimes it doesn't work out, but you are a patient, not a learning experience. You are a person. And sometimes when they look nervous or scared, you might need to reassure them. Be like, hey, listen, even if you haven't done it before, be like, hey, just so you know, I'm going to take very extra special care and attention for you. You're not this, you're a real person. You're not just something for me to use to learn. And it helps if you believe that. So that's why you should kind of cite that as well in your brain. Okay. All right. So the big one, right? Dealing with nurses that don't want a student. You show up and you're really excited and you go over to the floor and you see your nurse and they see you and they roll their eyes. And I flat out had nurses say to my face, I really don't want a student today, or great. I've got all this stuff going on. It's literally my last week here. And then they give me a student. Ugh. I've had some really bad experiences with nurses in the beginning of the day. So how do we deal with this? The whole nurses eat their young thing, right? You should ask yourself a few questions, knowing what I already talked about, right? This isn't about you, all of that. First of all, you need to keep all of that in your mind. Okay, so this isn't about you. This nurse has other responsibilities, and you are a wrench that was just thrown into their day. You could do something that would harm one of their patients, and they could bear some responsibility for that if they're the ones supervising you for that. Do you understand that? It's very important that if you mess up bad enough, that person's job or license could be in jeopardy. Even if it's not a reality, that's what this nurse is thinking. Also, you have no idea what kind of experiences in the past. I'm surprised by the amount of my fellow classmates that do not understand that likely a nurse is like this because they've had bad experiences with students in the past that have done dangerous things or something. They've had some bad experience. And you know what? It was probably multiple different experiences, because you got to realize nurse works like a few days a week. At least at the hospitals that I was at, they have students there 7 days a week from different schools. So you have different schools, different people, different semesters, and it's constantly changing and constantly rotating, and you never know what you're going to get. So there's probably countless bad experiences, or quote unquote bad students, and yes, there is a such thing, that this nurse has probably experienced. So ask yourself, why should this nurse trust you to do anything? Okay. The answer to that question is they should not trust you to do anything. Keeping that in mind, instead of getting attitude back or just becoming angry or immediately having your professor come and rescue you out of that situation, it would do you some good to try to adapt to the situation. Again, realize how responsible they are and how you are the variable they cannot 100% control. Okay? What is your responsibility? Your responsibility is to add, if it wasn't already there, you should always have this goal when you show up to a clinical site. How can I, in some way, form, or fashion, help my nurse in some way or save them any amount of time? So you need to prove yourself after having that goal. Without this goal in mind, you are not going to prove yourself to this nurse. Okay, no matter who it is. If they're not interested in answering your questions, you may not be able to ask questions. One of the things I have listed, 3 powerful things. One of them is to ask questions in such a way that they know that you know what's going on. You may not be a straight A student, and you may be completely clueless as to what's going on. But if you identify anything and you know the reasoning behind why it's happening, that's a couple layers deep especially, it would do you some good to ask your nurse about it in such a way like, okay, are we doing that because of this, this, and this? And if so, what do you do if X happens? Something that lets them know in one simple question very quickly, and ask it at an appropriate time, by the way, and a time where at least you guys are talking about that patient or there's downtime. You're basically having them understand at that given point that this person can think a few layers deep, they know what's going on, they're not a complete idiot, and they didn't ask, can I do this, can I do that, right? You're asking the thought process behind it, instead of saying, hey, what's your thought process behind this? No. For nurses that are really just angry that you exist, this is what you need to do. Another way that you prove yourself, honestly, at the onset, you need to communicate that goal of saving them time in some way. Be like, hey, look, like I just want you to know, I'll follow you around, do whatever you need. I know that, first of all, verbalize to them. I know there's things that, you may not be comfortable with a student doing, whatever. This is your day. This is your panel of patients. These are your responsibility. But my goal for today is to save you time in some way, or to make your day easier today. That's the only thing that I really want to accomplish. Everything else is secondary. You be very serious about that, and you make that very clear. And by the way, that should be sincere. You should take away the little things. There are some things that even from the beginning you are independent doing. If the CNA is busy, because they're always busy, because they work their asses off probably more than anybody else in a hospital, then that nurse would have to do what they would call a quote-unquote CNA task, which I hate saying that. This is just kind of the vocabulary in the ether, right? This is the attitude that is around, okay? So If they're not available for it, then that nurse has to do it. That nurse really doesn't want to do it. So what do? You can go and do those things. Okay. If you want to, somebody needs help to the bathroom or something, be like, no, let me do that. You're giving meds. Oh, can I get an apple juice with this? And the nurse didn't bring an apple juice. Let me get that. They're first with nurses that really don't want a student. You'll notice that when the patient wants a little something extra when they've already went and gotten something, right? Their first instinct is to immediately run out of the room and get it themselves. You're not there in their mind yet. They won't ask you to do it because you don't exist to them. They don't want you there. You will notice that before you quote unquote prove yourself, okay? That is something as simple as, oh, can I actually get another water before I take this? That nurse will just start going out of the room to get that. That's how you know, right? You need to stop that nurse and say, please let me get it. You have other things to do. You have bigger fish to fry, whatever. You let them know what you're doing is more important than something like that. Let me do that. That's what you have me here for, is to save you time. You're kind of making it about them and their day, and you'll notice a change 99% of the time. Again, I've had some pretty sticky situations, but within an hour or two, everything's fine because I've done these things. And then what do? They start saying, can you do this? Can you do that? Oh, would you? And then here's where you really won them over. Would you like to do this? Okay, that is wonderful. Let them know that you understand their next move before they have to explain it to you. That's a big one. This could come in the form of a question if you don't want to be like, oh, you're going to do this next. Come up with a way to do it. You're an adult human and you made it into nursing school. You're smart enough to figure out a way to do this. I won't go into a long explanation of how to basically let them know that you understand their next move before they do it. Or if that move surprised you, you maybe if they're receptive to other questions, you can be like, hey, I notice you did X. Take that opportunity to, compliments go a long way as well. I never would have thought about that. That's something that they'll never teach in school. Thanks. It goes back to the be grateful. So, those are just a few things. You have to basically, you have a nurse that really hates you and doesn't want you there. You need to prove yourself. You don't need to go whine about it to anybody. Learning from the real clinical environment. You're going there to understand how experienced nurses think, how they prioritize, pay attention to the workflow, pay attention to communication, how they delegate, how they manage their time. You'll notice every nurse is different about how they manage their time. Some of them are good and some of them are very bad. Some of them are, there are those people that are just always behind all day for no reason, no matter what kind of patient load they get. And you will notice, and you can make little notes to yourself of, okay, maybe I'm not going to take the time to do this because that caused that nurse to be 30 minutes behind. Okay. Learn what experienced nurses react to immediately versus what they calmly will just monitor. Okay. Observe how providers and nurses communicate in real situations versus textbook scenarios. You are basically comparing what have I learned to what actually happened here and why did it happen? Is this going to be different going forward and when I'm practicing as a nurse? And the reason why this is because sometimes it can be reassuring for you. Whenever, nursing school is extremely difficult. It's my third degree and it's the hardest thing that I've ever done in my life. These tests are extraordinarily hard. The material is so heavy that sometimes it just makes your head spin. But what you fail to realize is that these clinical experiences, you can notice things that they do that's different. That mean you aren't relying on the way that the material taught you or the way that you're going to be tested on it. Okay. In other words, it's like, oh, wait a second. Okay. Like I don't have to memorize all these things. I don't have to memorize all those steps in that particular order. This is the way that it's really done. So it allows you to be like, okay, it allows you to separate it a little bit. And not think the way that your exams all the time, you don't always have to think the way the exams want you to think in order to answer those questions. In other words, you realize that nursing isn't really as hard as nursing school, okay? making the most out of those big bad assignments, the journals, the case studies, whatever they're called, where you have to get every single thing about a patient. You have to make care plans. You have to do all of that. This is the bane of most nursing students' existences, but also this is the single most useful thing you will do in all of nursing school. More important than any other thing that you do, any other assignment, any test that you take, the clinical experience itself, okay, is not as important for developing your thinking and prioritizing and planning skills. Nothing is more effective than these, okay, depending on how your school has it set up and how often they have you do it. Some schools, I'm not one of these, some schools have you do these every single clinical experience. I don't think that is a good idea. I think that you should have these big bad assignments a few times a semester, and the rest you should be able to just, actually be present in the moment, not be worried about other things. So here's the question. How do you save time with the clinical assignment? Okay. The overarching thing is to, for God's sake, stop writing stuff down. Okay. If you have access to EHR, most of the time you get into you can chart things, right? That means that IT department has allotted you an entire Microsoft account while you are there under student. So you actually have an organizational email. The reason why that is important is when you log on to that system under that student account, you are logged into everything, including an email address. So you don't have to go in there and sign into another email and waste time doing that and multi-factor authentication. So now you're on your phone and the nurse is like, why the hell are you on your phone? So immediately upon this, you can open up an email address. You get all of this information before even your first day of clinical. This is your login. Well, guess what? That login at organization.com or .org, you get all of that before you start your clinical rotations. So here's what you do. Unless these assignments are to be delivered to your instructor handwritten, they're going to be in some kind of document and you're going to have to turn that document into Canvas or something, right? You're going to have to upload it and it's going to be typed. The issue that I see is students will take all of those forms from the assignment and they'll print it out, they'll put it on their clipboard, and they will frantically be looking through the chart and writing stuff down, and then they will hopefully get all the information that they need, but chances are a lot of times you really don't get every little detail that you absolutely need. And if you do, you're taking away so much from your clinical experience while you're there. And then they take that and then you bring it home and then you're trying to decipher what the hell everything is because you were probably writing really fast. And then you are taking what you've already written down and you're typing it back into the document that you printed out already. Do you see how inefficient this is? What you should instead do is you take that form and you email it to the email address given to you by the organization that is in charge of the clinical site. When you get there, you're going to log into everything. And guess what you're going to do? You're going to type directly into this document. And maybe you can have a couple of blank kind of pages at the end if you just need to put a bunch of random information typed that you can use later. The point is, typing is faster than writing, okay? Also, a lot of things, med lists, all of this stuff can be exported and copy and pasted or just copy and pasted into this document. So you're saving a lot of time in data collection. Once you have that data collected, a lot of which can be done with copy and pasting, by the way, you can even go in, and a lot of these assignments will have like a head-to-toe assessment. You can literally go in, pull it up in the computer, in the patient's room, and do your assessment and chart your assessment live in front of the patient inside of that document that you're literally going to turn in so you don't miss some little detail or have to make something up, right? So it's really important that, you take advantage of the technology that you have access to, because otherwise you are quite literally throwing away your time. You can do crazy data collection with copy, paste, and typing within like an hour. You can get all the information you need 100%. you can get it within an hour. Now, I mean an aggregate hour throughout the day. Obviously, you probably don't have an hour to sit there, nor should you be sitting there for an entire hour during your clinical experience. But you have like 2 minutes in between patients. You can get the med list and the HPI in 2 minutes, copy and pasted into your stuff. Now, here's the biggest thing, and this is the biggest kind of alarm bell that I'm going to say. Absolutely under no circumstance do you keep any PHI in that document, because what you're going to do when you're done with this is you're going to email this document that you've typed in and have all the information, and you're going to email it back to your school email so that later at home or whatever, or on your laptop while you're, at the end of the day, whatever, you can finish the assignment. But you can't email, PHI, anything with name, date of birth, anything that could identify that person, their social security, whatever. You can have date of birth, but you can't have like name. There's a certain amount of like pieces of information that are considered PHI. Just make sure that these things are removed, because it is quite literally a HIPAA violation to just take the HPI like, oh, Tim Jones is a 38-year-old male and he lives blah, blah, blah. And what he was doing, his sister Brenda was, all of those specific things have to be removed before you send that email. That is very important. If you think you won't get caught doing this, you are sadly mistaken. There is a whole set of protocols that a lot of hospitals put in place specifically to catch this. Everything coming in and going out at a huge healthcare organization is filtered and monitored, because there are specific loss of information policies that even every time you copy from the EHR, that is recorded somewhere. Everything that you look at, everything that you click, every keyboard stroke, all of that is recorded while you're in there. So if you're gonna, you can guarantee that if you're gonna send out an email and it has PHI in it, that organization knows about that. So be really careful about that. I know I talked for a little bit longer. I just really need you to understand, you just need to do that one step. Basically, you do two things. One, you're saving time doing the assignment. And two, you're making sure that the most of what you're doing when you're at your clinical site is not getting information on a computer. It's being present in the moment, which is what you want the whole time anyway. You're taking the unpleasant part of these assignments and you're taking it away from the clinical experience, leaving only what you really came there for, or what you think you came there for. And then you can work. It's easier to work with. It's easier to kind of rearrange stuff inside of a document. You don't have to bring 20 sheets of paper into the clinical site and be like, those little trifold clipboards, which I hate, by the way. You don't have a bunch of crinkled up papers that are folded 3 different ways, or, any of that business. So it's a lot actually easier to deal with. Okay. So, I think that's all I have. For this episode. I do have some other episodes coming up. I am doing an episode on online nursing persona and the debate of what kind of experience you should have before going into nurse practitioner school. Thank you so much for listening. If you like this podcast, go ahead and leave a comment. If you want to be on the podcast, leave a comment. And thanks so much for listening.